Welcome to Ask the Expert North Texas here on News Radio 1080 KRLD. I'm David Rankin.
And I'm Kristen Diaz. And on today's Ask the Expert, we're introducing Oded Eran. He is the co-founder at Connie Health. And, October is Breast Cancer Awareness Month. It's very important for all of us Texans to understand what type of medical coverage we have with those payments. Sometimes it can really start to add up, but you really want to know specifically your Medicare or your Medicaid coverage. It can provide a crucial role in providing access to essential screenings, your treatments, and even your support services. So, Oded, thank you so much for the time today.
Absolutely, my pleasure.
So tell us, what are some of the things as we are recognizing Breast Cancer Awareness Month that Medicare will cover for preventative screenings?
Well, that's a great question, Kristen. Actually, Medicare does a really great job with mammograms, and any person over 65 is eligible for a free mammography one every 12 months. And that's crucial, right? Because we really want to go in and get our preventive screenings. And, we know the statistics about early detection and how much it increases your survival rates. The fact that Medicare gives it essentially for free, $0 copay is really great.
If someone didn't have Medicare, someone didn't have health insurance or Medicaid, what would a mammogram cost out of pocket?
Well, I'm sorry, that's a really tough question to answer because we've all heard these issues about transparency in healthcare, where you go in, you think you're coming in for one thing, and then the reality is the doctor has to take a bunch of other procedures, and so it's hard to tell how much what the cost is. But what I think is important for your listeners to know is there's the preventive and there's the diagnostic. So if you go in for a preventive and then your doctor says, oh, actually, there's something that we need to go a bit deeper here and we need to get a diagnostic one, that one is not $0. That could be, depending on your coverage, if it's out of pocket, it could be, if you just have your Medicare Part B, meaning you do not have any supplemental insurance or a Medicare Advantage plan, that could be hundreds of dollars, depending on where to go. If you are on a Medicare Advantage plan, some plans in the Dallas Metro have it, again, for $0. This is zero, around zero. And some plans, it could be from a couple of dozen dollars, $30, $40, $50, up to $250. Something that is a number that we've seen in the current market. Also, important to say, a lot of plans, especially plans that cater to folks who are both on Medicare and Medicaid, offer free transportation. So it's not just that the exam itself can be $0, but you could also get free transportation to the doctor's office, which is also really important. And we know that transportation is a big social determinant, meaning people don't go and get their preventive stuff taken care of because they're like, I don't have a way to get there, especially with older Americans.
Absolutely. Now, what's the difference with the coverage that you might have between Medicare and Medicaid? And we're still, I guess, talking about preventative treatment.
So again, if you are on Medicaid, that is predominantly for folks who are lower income. Each state has a different threshold. For people who are on Medicare is a federally run program for older Americans over 65 who have retired. There is not a small subset of the population that is what's called dual. They are both on Medicare and Medicaid, so they receive benefits, what's called extra help.
When someone is over the age of 65, they're on Medicare, are they more likely to not seek screenings if they've done them perhaps all of their lives, that they figure nothing's come up before? Why should I continue to do that? Do you see that a lot in patients?
So I'm not a provider, and I think there's a pretty wide spectrum. But what we see, one of the biggest advancements in U.S. healthcare over the past decade is the rise of what's called value-based care, where in value-based care, the providers put a lot of emphasis on preventative measures, essentially to help drive better clinical outcomes. But we all hear about how expensive U.S. healthcare is, and so value-based care also helps kind of bend the cost curve. And so these providers, many of which exist in the greater Dallas Fort Worth market, put a lot of emphasis on preventive care, such as mammography, colonoscopy, your annual wellness visit, and so on. And so if you're an older American and you go to one of these doctors, I don't think they're really available stats, but I think you are more likely to take advantage of these preventive measures.
And how do we avoid scams? Because especially you were just talking about somebody who's older, who might be lower income, they might be on Medicare, Medicaid, but those are just trigger words for a lot of scammers, people who aren't on the up and up on how the system works and, may not have reached that age yet, or they're just now turning 65 and now they're hearing more about Medicare. Can we talk about how risky that can be as well? Just answering any questions about Medicare or receiving any phone call about Medicare?
Yeah, well, again, there's a lot, and there's healthcare fraud, which is done by clinicians, and there's insurance fraud that can be done by people pretending to be insurance company, insurance agency. I think one, golden rule: never give out your social security number. Medicare came up with a Medicare identifier, MBI, so that's much safer to share than your social security. I would generally advise people to not to only do interactions over the phone with people that they trust, institutions that they have they have prior experience with, or companies that they know are reputable, because otherwise you don't really know who's at the other end of the line in this day and age. People can get your authorization over phone, and so you have to be careful who you're giving your authorization to and for what. And generally, do not give out credit card information. It's pretty unlikely that somebody's going to need a credit card information in the healthcare, call it in a healthcare setting. Now, a bit more, as we talk about Medicare and we talk about healthcare fraud, there are, as a consumer, if you are in what's called a Medicare supplement or a Medigap plan, you have no out-of-pocket, that you only pay your monthly premium to your insurance company, which you sign up for, and you're by law to know who that is. So you typically have no copay. So the odds of somebody's asking you to pay something, that should kind of raise the red flag, like why am I paying this? In a Medicare Advantage plan, Part C, typically, if it's not your primary care provider, which you could know, then these insurance companies often require prior authorization, meaning the insurance company needs to authorize medical procedure, meaning it's much harder that you will be involved in a scam because insurance company needs to approve it.
Oh, that is Oded, Eran. Thank you so much for breaking this down for us and our listeners. We appreciate it. And thanks for being on Ask the Expert, North Texas.
Kristen, is there one last thing I can share with your listeners?
Absolutely.
October is Breast Cancer Awareness Month, but it's also the beginning of a Medicare open enrollment period, which starts October 15th. It's very important for all your listeners over the age of 65 to review their plan options. We all hear about inflation and the rising costs, and our research shows that 66% of Americans don't shop their plans every year. It is imperative. 30 minutes reviewing your plan options can save you thousands of dollars and get you better care, because there are thousands of insurance plans available. Your needs change every year, and there are great options available out there for you to go out and get better care and shop your care.
Absolutely. Very important. Thank you so much for bringing that to light. And we definitely can't wait to get the message across. We appreciate it.
Thank you, Kristen. Thank you, David. Pleasure.